Good afternoon, everyone. Welcome to today's webinar hosted by the American Academy of Pediatrics and healthychildren.org. Today, we're discussing respiratory syncytial virus, or RSV, which is one of the many viruses that cause respiratory illness in high-risk infants, preemies, and older children as well. This webinar will cover the diagnosis, treatment, and management of RSV, and we'll hear insights from our expert guest, a mom and neonatologist who treats newborns in the NICU. But before we get started, a few housekeeping items. This webinar is being recorded, so if you lose connectivity for any reason, you will be able to watch and listen to the archived webinar, which will be posted to our website in a few days. If we can help you with any technical issues during the webinar, please use the chat function to send us a message. We will have time at the end of the webinar for a question and answer session. To ask a question, please use the chat function. You can activate chat by clicking on the speech bubble at the bottom center of your screen or the person-shaped icon for mobile users. You can send in your questions at any time, and we'll get to as many as we can at the end of the presentation. Okay, let me introduce our host, Dr. Jennifer Shu. Dr. Shu is a practicing pediatrician, author, and mom in Atlanta. She is the co-author of Heading Home with Your Newborn and Food Fights. She's a frequent guest on national and local television, radio, and web-based programs. She's also served as the Living Well health expert for CNN.com. She's contributed medical information to Baby Center and WebMD and serves on the Parents Magazine Advisory Board. And finally, she is the medical editor of healthychildren.org, the official parenting website of the AAP. Welcome, Dr. Shu.
Thank you so much for that introduction and for having me on this panel today. As you all know, we are approaching the colder months, and respiratory illnesses such as flu and RSV tend to peak during this time. RSV is the leading cause of lung infections in infants and the leading cause of infant hospitalization in the United States. So joining us to talk more about RSV is Dr. Anna Zimmermann, a board-certified physician specializing in neonatal perinatal medicine with the Obstetrics Medical Group of Colorado. Dr. Zimmermann received her medical degree from the University of North Carolina at Chapel Hill and continued her residency and fellowship training at the University of Minnesota Medical Center and clinics. She lives in Denver with her husband and 3 kids. And in her spare time, she runs her own parenting blog, mightylittles.com, which is dedicated to sharing experiences that help shape the lives of parents. Welcome, Dr. Zimmermann.
Thank you so much for having me. I'm excited to be here today.
Okay, so not only are you a neonatologist in the NICU who treats sick newborns and infants with RSV, but you yourself had a frightening personal experience at home when your own children started showing signs of this illness, right? So can you share a little bit of your story with us?
Sure, absolutely. So, being a pediatric resident, I took care of a lot of children that were hospitalized with RSV through my training. And when I became a mom of my own, I knew RSV existed. It was out there. We got a notice from daycare saying that our daughter had been exposed to RSV, but I wasn't super worried. She was a big, healthy kid. And partway into her course, on about day 4, she just really started to struggle more. And she ended up being hospitalized with RSV for 3 days and then at home on oxygen for an additional 3 days. And then we had a similar experience with my son, different virus, but in a snapshot, my older daughter was hospitalized with RSV, and one of my twins was also hospitalized with respiratory illnesses when they were younger.
Okay, so scary to hear that. I know parents, always fear that kind of problem happening with their kids, and I'm really glad your kids ended up being okay. But why don't we talk a little bit more about the illness? What exactly is RSV?
Sure. So RSV is respiratory syncytial virus, and it's one of many viruses that can cause children to have respiratory symptoms. So runny nose, cough, fever. Most kids, most children, are going to be exposed to RSV in those first 2 years of life, with the majority of them contracting it in their first RSV season. And RSV is one of these things that for most infants, it just causes kind of what we think of as a cold, but it can lead to more serious infections in a portion of children.
So let's talk about, you said that it affects younger children the most. Are there details you can provide on who's at most risk for having complications of RSV infections?
Yeah, so we know that the children that are at most risk are those that are under 3 months of age at the start of RSV season. And RSV typically runs kind of October through April. So those kind of fall babies, winter babies are going to be at our highest risk. Babies that are born premature or have complications after birth, especially our kind of smallest preemies, so those that are born like 23 to 28, 29 weeks, those children are going to be at higher risk. Any infants that have an oxygen need, so premature babies that have chronic lung disease, infants that have difficulty with their immune system, or infants that have congenital heart disease, those are going to be our highest risk patients. But there's also a subset of kids that are going to have risk factors that aren't related to any underlying medical conditions, but are more related to kind of the environment. So really close living quarters, parents who have smoke at home, babies that have, or small children that have a history of allergies or eczema, or we call it atopic, where we know their immune system just is not quite going to fight that RSV the same way.
So let's move on to what kind of signs and symptoms parents might want to look out for if their child has a cold or RSV.
So most of the time, what really, really makes RSV different than a lot of the other viruses that cause us to have a cold is that children will just have a ton of secretions, just a runny nose that never ends. And all of us that have little kids know that our kids have runny noses for a long time, especially those that are in daycare or preschool. But this is just like copious tons and tons of secretions. Like most viruses, kids can have a fever, particularly if it's their first bout with RSV, a cough, a lot of congestion, sneezing, runny nose, and then poor feeding. But what we really want to look out for is those kind of more significant symptoms when we know that RSV might be causing a little bit more problems than just a typical cough or cold symptoms. So what we're looking for there is signs that babies are having trouble either eating and drinking, so they're just not waking up to eat, they're more lethargic, they don't want to nurse the same, they're not eating the same, they start to look dehydrated, or that they're having trouble breathing. And what that looks like is that babies are breathing really, really fast, almost think about like a panting. So their respiratory rate is like every second they're taking a breath or faster. You can see their nostrils flare out because they're really trying to suck in a lot of air. You can see their head bobbing up and down. They may make some sounds like a grunting sound, which I'm going to demonstrate, so you feel free to laugh. It sounds like this. That lets you know that they're trying to keep their lungs open, or if they're really using their abdomen and you can see their ribs when they're breathing. Those are signs that your child is working hard to breathe and that this RSV might be more serious.
Thanks for that demonstration. That was great. I think it's important to let parents know that just having noisy breathing isn't always a concern. So if it is coming from the chest, like you demonstrated, or wheezing, which is a whistle from the chest, definitely something to keep an eye out for. But just congestion in the nose where you hear their nose being noisy is typically not a concern if they are otherwise comfortable and breathing with a normal rate, respiratory rate. So at what point would a parent know that it's time to call the pediatrician?
So I think, as both a parent and a pediatrician, I want to just really reassure parents that we as pediatricians are never upset when you call. There is no call that is not a right call. So if you're worried, please call us. We're never going to be upset for you calling and wanting to check in on your kids. What we want to know about though, are when you start to see those kind of more significant signs of illness. So dehydration. So your baby isn't having a wet diaper every 8 hours, right? So 2 to 3 wet diapers a day is the absolute minimum. It should be more like 6 to 8. So if you're seeing decreased wet diapers, if your baby is not nursing well, if your child is refusing to eat or drink, if your kid is really lethargic and you're not able to kind of wake them up. And then all of those signs of kind of that lower airway bronchiolitis, the working harder to breathe, the breathing fast, those are things that we want you to call us about so that we can take a peek at your child. It might be that we just need to suck your baby's nose out and kind of do some education about staying hydrated and get the fever under control. But it might be that your baby needs a little bit more supportive care that you can't do at home.
Right. So like you mentioned at the beginning, maybe hospitalization for things like oxygen or IV fluid if they're not able to stay hydrated themselves, because it is hard to breathe and eat at the same time, especially if you're having trouble breathing. What about, is there a way a parent can know if it is RSV for sure, or can a doctor test for it?
So I think that's often one of the biggest questions that parents have, right? Is, well, is this RSV or is this something else? Because a lot of these viruses that we have over the wintertime months look very, very similar with a cough and a fever and a runny nose. So ways that you can kind of tell that it's RSV are going to be if you get a notice from a daycare saying your child was exposed and then a few days later your child gets sick. That's a good clue that it's RSV. That copious secretions that I mentioned, that's a good sign that it's RSV. That's a little bit different than other typical colds or the flu. And then you can go to your pediatrician and they can do early testing. There's swabs and there's viral panels that we can do that can let us know exactly what virus your child has. Knowing that it's RSV or knowing that it's rhinovirus or enterovirus or one of these other viruses doesn't necessarily change what we're going to do for your baby. It's all about supportive care, making sure they're hydrated and eating and breathing comfortably, but it may allow us to give you a better expectation of what's coming next because these different viruses sometimes act slightly differently.
And that's an excellent point. And especially if a family has somebody higher risk at home, such as a premature baby or one with, lung condition or heart condition, then it might be more important to know if an older child, for example, has RSV. So yeah, those are excellent points. So when exactly is RSV season? When would we expect it to peak?
So typically, RSV season has always been somewhere between October and April. Those tend to be, those winter months where people are inside more. That's when we tend to see RSV a little bit more. It varies based on your location, places that are colder, places that are warmer environments, what city you're in versus being out in the county. There may be some fluctuations in terms of when the big peak is, but it typically is October to April. I will mention, however, that during COVID, when everyone was staying home and wearing masks, a lot of kids that would have been exposed to RSV in that time period weren't. So we're seeing more of these older kids being exposed to RSV for the first time as we get back out into more routine life. And we were seeing some RSV kind of pop up in times like the summertime, August, July, where we typically hadn't seen it, just because there was this population of kids that didn't get that typical exposure in the winter months.
So you mentioned the COVID pandemic. What are some ways that parents could maybe tell, is this a regular cold? Is it COVID? Is it RSV?
So I think that that's a wonderful question. And again, knowing what virus it is doesn't change how we support your child through the illness, but it does sometimes change kind of your expectation. What's different about COVID is that you tend to have the sore throat, a headache, and loss of taste or smell. And I don't know any 3-month-old that's going to tell me that they lost their sense of smell. But what you might notice is that they're not eating as well because their throat hurts, right? So you kind of have to use that mommy intuition to try to figure out what's going on. Babies may or may not have a fever with COVID. Compare that to flu. With the flu, kids typically have a high fever. And yes, they can have loss of appetite and a sore throat, and they can have a stuffy nose. But with RSV, they tend to have a little less of a fever and a lot more stuffy nose. And as long as they're breathing okay, they're eating okay. It's when they start having trouble with breathing that usually it starts to affect their appetite. So those are some really subtle ways to tell which virus your child might have, but there's so much overlap. It's really impossible to know unless you get a test.
Would it be possible to have more than one of these, or RSV plus any other infection that's at the same time?
So unfortunately, yes, you can get more than one illness at a time. So the more you're out there and the more you're exposed to, you can be exposed to cold and flu in the same week and come down with both of them. Um, Again, it's supportive care. Kids that have multiple things on top of each other can be more sick than children who are just fighting off one illness. It's also possible to get like a secondary infection. So you get RSV, it kind of causes a lot of congestion. You're not moving stuff around in your lungs really well. And then you end up with a secondary infection with a bacterial pneumonia. So that's possible as well.
Yeah, and those are excellent points. With each virus infection possibly lasting about 2 weeks at a time, and kids maybe getting 6 different viruses during the winter months or possibly more. If you have 2 back-to-back, it can feel like that child is sick for a month straight. And especially if they have a fever, they could have a fever for many days at a time if you have them back-to-back. So yeah, unfortunately, it is possible to get a little bit at a time. Hopefully the child will make it, through each illness pretty quickly. Let's talk about protecting kids from RSV. What are some ways to protect, and is there a vaccine?
Yeah, so currently there's not a vaccine for RSV, but there's always new research that's coming out. People are doing work on antibodies, so hopefully we'll see something in the future. The biggest ways that we can protect our kids right now are just in the day-to-day things that we do to limit their exposure to that virus. So first and foremost, get your kids vaccinated against other illnesses so that if they do get 2 things at once, they're not trying to fight. Limit your exposure. So go to Target on Tuesday morning, not on Saturday afternoon. The best time to go to the big superstores is when your local football team is playing, right? Because fewer people are going to be there. One of the things that I really want parents to know is that as their parent, it is okay for you to tell people not to come over, right? Your grandma's second cousin's third uncle really wants to meet this baby, but they have some symptoms of allergies. But it's just allergies. As a mom or a dad or a grandma who's caring for a child, it is fully within your right. And I encourage you to say, oh, I can't wait for you to meet this baby once your allergies are gone. Why don't you come back next week when you're sure it's not a cold, that it really is just allergies? Nobody should make you feel bad about that as a parent. Good hand washing, investing in some hand sanitizer that you keep at your front door or your back door is going to be really, really helpful. Wiping down surfaces, taking toys and cleaning them between kids playing, those are going to be really good. Breast milk is going to have some really good immune system properties. So if you are breastfeeding, that's going to be protective for your baby. And then probably my biggest trick for people who have infants at home and toddlers in daycare is, remember, RSV is shed through droplets that kids sneeze out and get on their clothes and their toys and they're touching it. So when your toddler comes home, even if your toddler isn't sick, they've been exposed to a bunch of stuff at daycare. And not only is it on their hands, so we want to wash their hands, but it's also on their clothes. So keep a laundry bin at your back door and have them go ahead and take off their dirty daycare clothes and wash their hands, wipe them down with a wet wipe, and put their jammies on right as they come in the back door, and then let them come in and see the baby. That's going to be a really good practical tip for kids that have little ones plus toddlers at home.
Those are excellent tips. So it's interesting because that's the exact practice that I followed at the height of COVID. As I would come home, I would change all my clothes, leave them at the door, take a shower. So yeah, it sounds like the exact same thing. Just leave all the germs at the door. Let's see.
Yeah, I'll just mention that it's what we did when my twins came home. They came home in March, and my older daughter was in daycare, and it was a late peak for RSV that particular year, and I just made her strip all of her clothes off and had a hamper at the back door, and it kept my twins healthy for the remainder of that RSV season, which that was the goal, right? Was to keep them healthy.
Right. And I think we have another slide touching on all the topics that you just talked about. Um, Oh, I thought there was more on that slide, but anyway, that's good. One thing I do like to tell parents is, you know what, it can be awkward to tell your family not to come over yet. So meet outside, meet on a porch or something like that. And then feel free to make the doctor the bad person in this situation. Just say, my doctor says I can't have any visitors until my baby is X age. And you can say 1 month, you can say 2 months, whatever it is that you decide is reasonable for your family, or talk to your doctor about what they recommend. But I definitely don't mind being the bad person in this situation and not allowing visitors at the the early stages of life, especially during cold infection season. So we're moving on to slide number 14. Let's look at ways to keep a sick child more comfortable. What can you recommend, Dr. Zimmermann?
Yeah, so, like I've said before, there's no cure for RSV or a specific medication that you can give for RSV. So, really, what we want to do is help our child feel more comfortable as their body is fighting this infection. So, using some normal saline, there's little bullets. I know that's a funny word, but there are little pink bullets that you can get that you can drop some saline in their nose, or a saline spray will help
Or
break up some
vials,
of
you can
that.
call them vials.
Yeah, vials. Break up some of that congestion to help you use some sort of device to get all that snot out. The hospital grade bulb suckers are really good, and there's videos online that show you how to use them more effectively. And then there's also different devices where you can kind of suck on the end of it to get some of that snot out. So really trying to keep their airway, their nose clear so that they can eat. That's going to be really good. I also recommend for the slightly older kids, so kind of, the 6 months to 2 years, um, going into the bathroom with them and being in a nice warm shower can kind of give all this or all this humidity, or have a humidifier kind of in their room that is going to help as well. Just trying to get them to eat and stay hydrated is going to be one of the biggest things. And this is one of those times where I don't care if you're giving them the most nutritious fluids. Juice, which we don't usually recommend, is just great. Popsicles are just great. Just see if you can't get some fluids in them. And for your breastfeeding babies or your formula fed babies, you might need to do smaller, more frequent meals, smaller, more frequent feedings in this period, because they may get tired towards the end of the feed. And then the final thing that will really help keep kids comfortable is nobody feels good when they have a fever. So you can use medications to keep their temperature down, which always makes babies and little ones feel better.
Thank you for those tips. We are moving into the question and answer portion of our webinar right now, and I did see some questions coming through, so thank you for that. The first question kind of ties into what you were saying about taking your baby into the shower maybe with you, having that steam, some warm water to keep them comfortable. What frequency would you recommend? How often should you give your baby a shower, or is there a limit to how often you should do this?
Yeah, so there's not necessarily a recommendation or a limit. If you live in a particularly humid environment with lots of moisture in the air, it's going to be less helpful than if you live in, say, Colorado, where I live, um, where there's no moisture in the air. And so you can sit in a bathroom that's filled with steam for 6 hours if you want to. I wouldn't have them in the tub or soaking in the water that long, but you could be in a steamy room for that long just fine. I tended to put my kids in it kind of towards the end of the day, right before bedtime, so that it really broke up the mucus. I could suck their nose out really, really good before they went to bed. So that would kind of be, there's no magic number of times or hours, but that's when I would try to do it, or at the peak of the cold when you really need to get those secretions out.
Okay, great. The next question is, can you get RSV more than once? What say you, Dr. Zimmermann?
That is a really good question. Yes, unfortunately, you can get RSV more than once. But remember, once you've seen it once, your immune system is going to recognize it. And so typically, the subsequent infections with RSV are a little bit less severe. So that's one of the reasons why, in adults, we just have a runny nose for a day. We don't feel really great for a day or two, but we actually have RSV. And so we can pass that to the babies. But you don't know you have RSV because you don't get tested for it because it's not really that bad. So can get infected multiple times. Adults can get infected later in life. This can recur, but it tends to be less of a fever, less of a runny nose, less severe symptoms on the subsequent infections.
And that's another reason why we would want, that relative with the allergies to kind of stay away, because those allergy symptoms could easily be confused with cold or RSV symptoms in an adult. And you'd want to delay a young infant getting it as long as possible, because as they get older, their lungs are stronger, their immune systems are better. So if you can delay them getting RSV until they're older, that's always best. Let's talk about, if you do get RSV at a young age, is there some kind of risk for problems in the future with any permanent lung effects from having RSV at a young age?
So I think that that's a wonderful question, and one that is kind of a little bit like the chicken and the egg question. So we know that children and small infants who are hospitalized with RSV are more likely to have wheezing or reactive airway and asthma as as they grow. But the question really is that because there was something inherent to them that set them up to then RSV was just the first time that they presented with those symptoms? Or is it because the RSV then made it so that they would have wheezing with subsequent things? So it's a little bit unclear. The majority of children are going to recover from RSV just fine and not need hospitalization. It's just a small percentage that needs to be hospitalized. But there is this association with hospitalization and RSV leading to, or those are the kids that we end up following more long term who have kind of reactive airway or need a little bit more support when they get viruses as they get older.
So this is a follow-up question to something that you were talking about earlier about how the first infection could be more severe and then subsequent ones being less severe. Is it possible for an infant to have a very mild case of RSV the first time they get it?
I mean, it certainly is possible that when you have it, that it's a very mild case. Lots of kids get RSV, lots of kids have a runny nose and a fever, and they do just fine. But most of the time, if you've gotten it once and it's been mild, it would be unlikely for you to then have a worse case where you would require hospitalization because your body again has already seen it. You're bigger, you're stronger, your lungs are bigger, they can handle those secretions a little better. But remember, we don't always know exactly what virus is there, and there's always confounding information, right? Like, well, maybe at that point in time you were exclusively breastfed and you were getting some immune system stuff, and now you're 14 months old and you aren't getting that protection because now you're on a full table food and milk thing. Maybe the first time you got it, you just had RSV, and the second time you get it, you have RSV and flu at the same time. So, those types of things play into each time you get an infection, how your body is going to respond to it.
What about childcare exclusion or staying out of school when a child has RSV? What's your recommendation on that?
So, most of the time, daycare centers and school have very specific guidelines for you have to be fever free for 48 hours type of thing. If we never sent any child to school or daycare with a runny nose, we wouldn't have any childcare. So when your child has a fever or is in the thick of the infection, don't go to school. Try to be protective. But these coughs can last for a week afterwards. And just having the cough, once you've kind of crossed that 4 to 5 day period of the height of infection, that cough can linger and your kid isn't still infectious. They're just clearing the residual stuff out of their lungs. Then it's okay to go back to school or go to daycare.
Right. So the first few days are most important, most infectious. Let's move on to talk a little bit about, you talked about vaccines, monoclonal antibodies with new stuff being on the horizon. And you also did talk about the importance of children getting their own other childhood vaccinations, such as for flu. Wanted to also put in a plug for parents, grandparents, other caregivers to get their Tdap vaccine when a newborn's around, and also get your flu vaccine. Make sure you're up to date on COVID vaccines, because you want to build that protective cocoon around these babies who can't get vaccines for these illnesses yet because they're too young. Most of these aren't approved in babies until they're at least a few months of age. So what about there is an antibody for certain infants at high risk? Is that something that you would recommend for some babies?
Yeah, so there is a medication that is a monthly injection that's antibodies that we give to our highest risk infants. So those with congenital heart disease, who are oxygen dependent, who have a known immunodeficiency, or who were born very premature for their first RSV season. Those children can get those monoclonal antibodies. And it is the single best way that the parents of these highest risk infants can protect their kids, in addition to that cocooning and the protection from visitors that we've kind of touched base with already earlier in the webinar.
And there are some vaccines on the horizon, maybe for pregnant moms as well as for infants against RSV. So stay tuned. I'm really hopeful that those will be available in coming cold and flu and RSV seasons. Let's talk about, at some point you kind of mentioned oxygen being low and having to go to the ICU or the hospital if a child is having an oxygen requirement. Are there ways a parent can test for that or check for that at home, or how would they know if their child has a low oxygen at home?
Yeah, so I think for sure, we know that RSV can cause our oxygen saturations to go down. And that is exactly why my children ended up in the hospital needing oxygen. That's what we saw. So from a low tech kind of standpoint, when kids' oxygen saturations are lower, they are going to breathe faster. So that panting respirations where they're breathing kind of more than once a second, just at rest, that's going to be a sign that your child's oxygen saturations might be low. You can also look for changes of color around their mouth or on their fingertips. To be honest, even as a pediatrician and a mom, I find that to be a hard sign, right? Like your kid may be in distress and have low oxygen saturations well before you start to see any color change. So I wouldn't use that as my single best predictor. I like the breathing fast a little bit better. And then, there are a lot of monitors that are kind of coming out and at home. There's infant specific monitors that you put a pulse ox on their foot or their finger. There's the regular pulse ox kind of finger clip ones that you can get from Walgreens that will show you what the saturations are. For our smallest kids, those finger clip ones, oftentimes their finger isn't big enough, but you might be able to get it to work on the thumb of, say, a 6-month-old or a 9-month-old. For little infants, it probably isn't going to work. Those can either be reassuring or kind of the your mommy gut says, I think something's wrong, but I don't want to overreact. So I'm going to check this pulse ox and then go to the pediatrician. It can kind of be that impetus to kind of push you to trust your mommy gut that you already knew. The biggest downside of any of those monitors is that they can give you a false reading. So if your child looks great, is running around and playing and eating and breathing comfortably, you don't need to use that pulse ox because it's not going to give you any different data. It might only give you a false number that's low that makes you worry more than you should. Versus if your kid is breathing really fast, doing the pulse ox and getting a normal reading, if you have a good waveform and you know it's picking up, may give you some reassurance that everything is going okay.
I love how you said to trust your parent's sense, because as a parent or a regular caregiver of a child, you know that child best. And just yesterday, I had a toddler in my office who I thought looked great. He was, he was precocious and actually speaking full sentences. And I thought, and not even coughing in my office. And I thought for sure he was fine, but he had a low oxygen saturation of 92%. And I never would have known that because he wasn't breathing fast, he wasn't grunting. And so I think a parent would have seen that this kid was less active than usual, but I don't see that. So definitely trust your instincts if it's something that you feel is off. We have time for one last question, and that is, are there certain medications, remedies, or treatments that you think would be safe to use in a child or infant who has RSV?
So, I guess I'm wondering exactly what they're asking about, right? So we talked about medications to bring fevers down. So that's one that I would recommend. We talked about saline to kind of help break up that congestion. I don't recommend like cough medications and things like that for our smallest kids. And in terms of like more alternative things, um, uh, like eucalyptus or mint or having something that helps open up the airways. I like that for some of our kind of older small kids, which I know seems kind of silly, but like those 9 months and above, not for our smallest kids. I'm not sure if that gets at what the person was asking specifically about.
I think I'd just make the point that cold and cough medicines, traditional ones that suppress a cough, for example, would not be typically recommended in kids younger than 6 years old. And the reason for that is that the potential harms can outweigh any potential benefit. And definitely, this is a great question for your pediatrician. Talk to your pediatrician to see what they recommend. Is there something safe? Honey over the age of 1, for example, might be something good to try. So definitely that's a great question. Somebody talked about, are there signs to look at if your child is sick? And one thing that we can look at is a child's respiratory rate, which is how fast they're breathing in a minute. And you can easily use your watch or phone to count a minute and look at how many times your child's chest is going up and down. And for an infant, you really want that number to be below 60. And there are definitely good references on healthychildren.org and other websites that can give you ranges for normal respiratory rates for a baby and child. So anyway, that is the amount of time we have left for our questions. I wanted to thank everyone for joining us today. And I would like to turn this back over to AAP staff to close us out.
Okay, thank you so much, Dr. Shu and Dr. Zimmermann. That was great. We want to remind participants you can register on healthychildren.org to receive our newsletter, a personalized homepage, and special offers. And don't forget to follow healthychildren.org on Instagram, Facebook, Pinterest, and Twitter. We hope you enjoyed today's webinar. Keep an eye out for a quick survey and let us know what you found most helpful and any suggestions you may have. And a special thank you to our sponsor, Sanofi. Thanks again for joining us.